This program is brought to you by the following proud sponsors: the Alltech Media Group, the region's leading multimedia video production and marketing company, creating powerful and innovative marketing strategies that deliver exponential returns. And by California CEO Online Video Business Magazine, providing California's executives and regional leaders with economic development resources and regional branding solutions. And by StudioCast Pros, taking your web branding strategies to a new level by creating world-class online programs proven to engage audiences and enhance profits.
Well, welcome back, everybody. This is the 1 Million Cups Riverside, and it's a beautiful morning in Riverside. I hope you're all enjoying it. I've got Ralph Richardson here to talk to you today about tribal wellness. He's a co-organizer of 1 Million Cups, and like all of us, he's got a startup. Ralph?
All right, my name is Ralph Richardson, and I'm here to talk to you today about a project that I'm really excited about. It's one that we're currently exploring, and it's called Tribal Wellness. So just a little bit about myself and the project. You can follow me on Twitter, and I am a tech entrepreneur. I've been building websites and applications for about 12 years for various companies, and I'm now working on a project that we're very excited about called Tribal Wellness. It's also online at tribalwellnessapp.com if you'd like to get some more information, or follow us on Twitter at tribalapp. All right, what is Tribal Wellness? Well, Tribal Wellness is a worksite wellness company. And right now we're an early stage startup. In fact, we're so early that we're not in beta, we haven't started yet. We're in what we call our research or customer development phase. But what we're looking to do is use mobile technology to create innovative workplace wellness solutions. So what is the problem that we have? What are we trying to solve? Well, this is really obvious, but companies are looking to save money on rising healthcare costs. In fact, companies typically for a family of spending about $16,000 or more on the annual healthcare premiums. And you, as a worker, are contributing about $4,500 towards that. And, you know, costs are continuing to rise. So in 2013, we're looking at like a 4% increase in healthcare premiums. Problem number two, 86% of full-time employees are either overweight or have at least one chronic condition. And you know, the reduction of chronic conditions has a direct impact on your healthcare costs or healthcare premiums. So companies are looking to reduce chronic conditions, and they're trying to get their employees to, you know, to lose weight and to get into shape. So what is our solution to these two big problems? And there are a lot more problems, but just because of time, these are two of the big ones. Well, what we're looking to do is create a suite of mobile apps, not just one, but actually, you know, maybe half a dozen or more apps that each tackle a specific element of wellness. And we call this habit hacking, right? We're focusing on helping people create new healthy habits, maybe ignore old habits that are encouraging them to do things that are not good for them, in these 5 different areas: diet, water, fitness, sleep, and developing or, you know, getting rid of routines that are not good for them. So a very important point is that in our research, as we've been talking to potential customers, we've discovered that most companies actually have a portfolio of programs that they offer to their staff. So we're not trying to be the only program. We want to be part of the solution. So we look at ourselves as just, you know, one of the pieces that a company will offer as a comprehensive solution. So what unique value do we have to offer as opposed to maybe some of the other programs that they already have in place? Well, we have a turnkey program that's very easy for wellness professionals to implement. Our program is definitely designed to motivate individuals to keep a promise to themselves. And it also leverages motivation from the people that you spend most of your day with. In our apps, because they're mobile, they're social, you can kind of stay in contact with each other during the day as you're, and I'll have an example of that. So mobile apps, I should also mention that we plan to use existing APIs with Fitbit, Nike Plus, maybe popular wearables like the Apple Watch and the Samsung watches to actually record some data and minimize emotive effort to get information into our system. And then the other thing is we want to have a principle-centered program that's backed by scientific research. So we are working with health professionals. Ultimately, what we like to do is help companies change their culture and make healthy choices the popular choice. So a little bit about our team. We have a team of 3, including myself, and we have an awesome designer, Luke, and Mike, who's our CTO. And we have also some really great advisors, including Jay Goth, who's a senior consultant at TriTech, Columbus Batiste, who's the chief of cardiology at Kaiser Riverside, and Shane Simmons, which is the national accounts manager at Nobel Biocare, Mike Kennedy, who is in technology at UCR, and also Scott Mott, one of the developer evangelists for SendGrid. So I talked about customer development. What is that? What we're trying to do is we have a survey that we're conducting right now where we're talking to HR managers, wellness coordinators at companies, and we're asking them these 7 questions. These 7 questions are really focused on figuring out what problems they're having right now. Like, what challenges are they having? Because what we'd like to do as a new company is understand their problems in detail and offer solutions that solve these problems. As part of our research, we actually are experimenting also with one of our ideas. And this is actually our one of our fitness challenges. And we have, this example is showing 2 different teams. One team is with actually my daughter and I. And in this case, my daughter's working on doing back bends for gymnastics every day. She'll actually do that, and then she'll use the app to check in with me. And then I say, hey, awesome job, great job. And for me, I'm actually drawing a picture every day for 30 days. And then we have another team here where you see Mike and Kevin. They're actually working on something as well, and they're basically going for a run or meditating or doing something interesting, and then checking in with each other every day. And we've been running this program for about 30 days, and we're learning a lot from it that we can use to develop our own product. All right, so how can you help us? So what are we looking for? Well, we need introductions to HR managers, wellness coordinators, anybody in health insurance or risk management, or even alpha or beta testers that want to help us with some of the programs that we're experimenting with, so that we can continue our research phase, get more information, and make some good decisions on what that portfolio and what that suite of apps should be. And that's it for Tribal Wellness.
Great. Well, thank you, Ralph. First, I'll open it up to questions from the audience.
Ralph, I love what the concept, and obviously in healthcare, the best way to lower costs is to eat healthier, live healthier, and have prevention. When you're talking to HR managers and wellness coordinators, what is it about your program that is the hook? What makes it different than other programs out there? Or what make employees want to actually follow your program?
So our goal is to talk to maybe about 40 or 50 different companies and really understand what their problems are. So far, we've talked to just a little over half a dozen. And there are a couple of key things that are really challenging for them. a lot of the programs that they run are in-house, and maybe they're tracking how much water their staff are drinking. They're doing it on paper and in spreadsheets, and it's really a manual process. So what we're offering is, we'll take a look at those programs that they're saying, hey, these are working really great, but it just takes a lot of my time. This is probably not my full-time job. It's just something that I'm doing that's additional. I really need a program that makes it easy to get my staff signed up and monitor their progress and have some data that I can look at to show that this program was a success. So, I'm kind of bundling some of the challenges in that answer, but, data is definitely a problem. A lot of them are saying, hey, we're offering programs, but we don't really have an easy way to track our success. One other example would be churches. That's a potential customer for us. A lot of the churches, for example, it's a volunteer. They have a full-time job, and they only get to see their parishioners once a week. It's really, really hard to monitor and stay on top of, how those programs are running. So we're saying, hey, let's offer a mobile solution. Everybody's got a mobile phone in their hand. It just makes it easy for them to sign up. And then, the person that's running the program has a dashboard on their computer to see, how people are using the platform.
Have you approached, for me, it would be, I would think it's the insurance companies. I mean, like auto insurance, if there was a way to say to insurance companies, if we can get this person with this policy to drop 100 pounds, what will you do for him? In other words, if you drive safe, you pay less in car insurance. So say I'm paying that $16,000 a year, and the insurance company says to me, Dwight, if you and your family get into this healthy weight period, we'll drop your insurance costs by $2,000 a year. Then I think, unfortunately, in today's world, money makes people go. So if there was a way, I think where your success of your program would be, is if an insurance company would say, if your company buys into this program and your employees buy into this program, we'll reduce your insurance costs by this much based on the success of your program. So if I'm a business owner and I've got 100 employees and I'm paying, $160,000 a year for insurance, and I'm going to drop that to say $120,000 and save $40,000 a year in medical costs because my employees are healthy, you've got my attention. So I think it's not just like, you're working with Kaiser. Kaiser would be a great example of that. I know I pay $16,000 a year to Kaiser for my family. And if Kaiser said to me, we'll drop that $2,000 a year if you drop that 50 pounds, I'd probably drop that 50 pounds tomorrow. There's the incentive. To me, that would be, have you thought about that? Because I think that would really enhance the marketability of your app, because now there's a financial reason for me to do it. But if I'm going to do all this work, people aren't motivated, I don't think.
So I think you make a really good point. As we've been interviewing our customers, we've discovered that, for this product, the customer may in fact actually be the insurance company or broker. Some of the insurance companies will have in-house wellness coordinators that actually provide and develop a suite of programs that they offer to their customers. So sometimes the wellness coordinators at the company, and sometimes if you have the relationship with the health insurance provider, they're actually developing those programs and offering them to you as a value-added service. So we're talking with companies, and we're also talking with insurance providers as well, because either one of them could be the customer. But ultimately, companies are looking to reduce, they want to get their customers or their staff to lose weight and reduce their chronic conditions, like high blood pressure and reduce your chance of diabetes and all of these things, because ultimately, like you're saying, they're going to have a bottom line impact. What the insurance company will do And so come and say, this year you've had an increase in chronic conditions, and Ralph and some of the other staff are making claims by getting, blood pressure medication and other things. And, they're making all these claims, so your costs are going to go up. But if you can reduce that, then your premiums, potentially could be less. So
I think that on the average, but I think I think really the target market is the insurance carrier somehow reducing their rates. And I know when I pay for my insurance, they don't ask me how heavy I am. It's a flat rate. You got 4 kids, wife, kid, you're this age, and it's a flat rate. But if they said, if you were healthy, we're going to charge you less. And if you're not, and that, it punishes those that aren't. But if you're not willing to take care of yourself, then you need to pay the freight.
Well, important to keep in mind is that this is really a grassroots kind of thing where it's going to the individual and it's helping them make little incremental changes. And that's one of the things that really attracted me when Ralph explained this process to me is, how do you change a habit? You don't just wake up one day and say, I'm changing. It's something that you have to ingrain in your mind, and only the individual can make the decision. So like you're saying, Dwight, an insurance incentive, that's a big incentive, but they still have to decide whether it's quitting smoking or quitting drinking or whatever habit they want to change. It has to come from within. So I think one of the key things is the social aspect of getting that kind of validation and feedback from your friends that can actually make the change happen. And then an intangible that we don't think about but is really true is that a healthy employee is a more productive employee. And ultimately, the insurance company doesn't care about productivity, but the company certainly does. So when you combine the insurance benefits of having a lower rate with the social integration and all the things that they have, I think you've really got a good idea here, and I'm excited to see it go. Any other questions?
Is there any, along the lines of the feedback, is there any sort of plan for how to get feedback, maybe information about how similarly situated people are approaching their goals? So if, say, somebody has taken off 20 pounds this month, without necessarily telling you who that person is, if your goal is to take off 20 pounds this month, maybe you could get some sense as to what are they eating, what are they drinking, when are they going to the gym, how are they achieving this? Because I think that's one of the things that's missing from a lot of the systems. You don't know what everyone else is doing. You see them reaching their goals, but you have no clue how.
So one of our ideas is to put people in small groups, of maybe 5 to 15, and these are the people that you're spending most of your day with. You get there from 9 to 5, you're seeing each other every day, and if let's say you and I are on the same team and we are working on similar goals, we want to lose 20 pounds. If you're having more success, then, because I'm connected with you in the app and at work, we have an opportunity to share. So, specifically with Tribal Wellness, there are other apps that do things that are similar, like let's say Nike Plus. There are other people that maybe I run with and we do challenges together. But oftentimes, I'm hooked up in Nike Plus with my sister, who's in another country. So even though we may be running, we're not necessarily there to motivate each other, person to person, which I think is one of those key factors that some of the other apps are missing. So we can share information of how we're succeeding, but we can also motivate each other on the app and in person. So.
Yeah, Ralph, I want to make 2 introductions for you.
Okay.
One is a social introduction that I think would be very beneficial in terms of the grassroots efforts. And the other one is at the hospital level, because the change in healthcare now is hospitals in general are now beginning to get paid more for the health of the patient versus the treatment, and that's a pretty significant shift. And what you've designed and what you have your program, I think could fit into that in terms of tracking the health of the patients. And so I think in terms of funding and partnerships and the business model, that might be a good fit for you. So what are your thoughts?
Well, and I want to add, one thing to, first of all, thank you for, offering to make some introductions. We definitely would appreciate that. We're discovering that there are programs offered by the insurance companies and sometimes the employers that are really trying to get very detailed information about the health of their employees, right? And so one of the approaches that we're taking as well is we want to keep it very simple and fun. And we want to start people small. Like, we want to help you to make small changes and kind of work towards making bigger changes. So as part of just talking to people, we've had staff tell us, listen, I'm not going to go run right now, but I could maybe drink more water, or maybe I can work on my diet, because I've got to work towards being in a position where I can go run. Like, maybe I can walk right now just around the block. So we need to develop programs that address where people are at, and it needs to be individual to them. That's the other challenge that we have, is finding everybody has a specific need, like for where they are with their health and fitness objectives. So we need to develop programs that are fun, interesting, social, and simple enough that it's easy for people to adopt. And maybe some of those other programs that are more comprehensive, where you have to go in and see a doctor every month and get health screenings and these types of things that they are out there. Maybe we can move them in that direction. So, like I said, we want to be part of the portfolio of offerings that companies will have.
How do you plan on monetizing this compared to like Nike app or the MyFitnessPal app? Because again, the MyFitnessPal app that I'm familiar with, it does have a social media component that you can share what you're doing with others. It's pretty elaborate when it tracks what you do, what you drink. And that's a free app. So how do you plan on monetizing your app once it's developed?
So that's a really good question. When we started this project, we wanted to build a B2B company. So we were very intentional about saying, hey, who's the customer? The customer would be the company. They would pay us a monthly fee for access to our suite of applications. We anticipated they would use app number one for maybe a month or 3 months, and then they'd switch to another one, depending on, after we go in and assess the company and maybe work on a plan with them. But our customer is either the company or possibly the insurance company. We don't expect that the end user would actually pay for the product.
Right. Well, I love the gamification aspect of, taking groups, small groups, and then maybe pitting them against each other, forming challenges, making a game out of it, really gets you more excited about it. Ralph, is there anything else that the Million Cups community can do for you?
Well, I think right now we're very focused on completing our research phase. So introductions is really the number one thing that we're looking for. And anybody who's involved in the fitness and wellness business would really be someone great for us to talk to. Like I said, we're going to talk to at least 40 or 50 companies before we actually make a final choice of what solutions we're going to provide. So.
Interesting. I had a discussion with Loma Linda University Medical Center recently, and the Inland Empire has a problem with diabetes and pre-diabetics. And so they're focusing on a wellness campaign for the region. And I told them about your company, and they were already aware of you. So you're starting to make some inroads in the community. So that's great. Thank you very much, and thanks for your presentation.
All right. Thank you for having me.
This program was brought to you by the following proud sponsors. The Alltech Media Group, the region's leading multimedia video production and marketing company, creating powerful and innovative marketing strategies that deliver exponential returns. And by California CEO Online Video Business Magazine, providing California's executives and regional leaders with economic development resources and regional branding solutions. And by StudioCast Pros, taking your web branding strategies to a new level by creating world-class online programs proven to engage audiences and enhance profits.